Hello medicos. So today we are going to start our lower limb series. In this lecture we are going to discuss about the hip bone and the femur as well. So we'll begin with the hip bone. So hip bone is made up of three major bones. This bone I marked green is known as ilium. Now this part is known as the ischium, okay, and this part is known as the pubis. Now we are going to discuss the bony landmarks of the ilium. Anteriorly, there are two spines which are known as anterior superior iliac spine anterior superior iliac spine and anterior inferior iliac spine. Posteriorly, there are another two spines, posterior superior iliac spine and posterior inferior iliac spine. This margin which joins the anterior superior iliac spine with the posterior superior iliac spine is known as the iliac crest. This iliac crest has three lips. Lateral lip, or we can say outer lip, next is the intermediate lip, and medial lip or inner lip. So let me mark the lips here. See, you can see this is the outer lip, this one is the intermediate lip, and inside we can see the inner lip. This surface of the ilium is known as the gluteal surface or the outer surface of the ilium, okay. This is known as the gluteal surface of the ilium. This gluteal surface has three lines. First line, second line, and third line. These lines are known as the gluteal lines. These lines are known as gluteal lines. Gluteal lines are then, these three lines are then named as inferior gluteal line, anterior gluteal line, and posterior gluteal line, okay. Then we look at the inner view of this hip bone, of this ilium. See, I told you this was the inner lip, then intermediate lip, and the outer lip, okay, of the iliac crest. This is the iliac crest with three lips. Then this is the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine and posterior inferior iliac spine. Here you can see a ear-shaped demarcation. This area is for the attachment of the sacrum bone to the hip bone. This is known as the auricular surface of the ilium. Auricular surface of the ilium. Okay. Now there is another line. You can see this line. This line is known as medial arcuate line. Medial arcuate line. Just below the posterior inferior iliac spine you can find a notch. This is known as greater sciatic notch. Greater sciatic notch. Similarly, here also you can find this same greater sciatic notch. Okay. I told you that this surface is known as the gluteal surface, but this inner surface, this surface is known as the iliac fossa. Inner surface, which is also known as the iliac fossa. Now we'll look into the ischium bone. This one is the ischium bone, and between the ilium and the ischium there is a clear line of demarcation. You can see this line. This line clearly demarcates the ilium bone and the ischium bone. This part of the ischium is known as the body of ischium, and this is the ramus of ischium. This part is body of ischium, and this one is the ramus of ischium. This rough portion of ischium is known as the ischial tuberosity. And also you can find a spine-like structure here. This is known as the ischial spine. Ischial spine. Just below the ischial spine there is another notch which is smaller than the greater sciatic notch, and hence it is named as lesser sciatic notch. Okay. Let's look into the inner aspect. See, this area is known as the body of ischium. This is the ischial spine, and this notch is known as the lesser sciatic notch. This one, ischial tuberosity, and this one, ramus of ischium. Now, one more feature. This foramen opening, this is known as obturator foramen. Okay. What is it known as? It's known as obturator foramen. Similarly, in the inner aspect also we can find the obturator foramen. Next, we'll have a look on the pubis bone. Okay. There is a tubercle here which is known as the pubic tubercle. Pubic tubercle. In this pubic tubercle, it gives the attachment of the inguinal ligament. Another surface is present here, like this. This is known as symphyseal surface. Symphyseal surface. Symphyseal surface. This margin, which is a continuation of the medial arcuate line, see this one. Okay, this margin is known as the pectineal line. Okay, what is it known as? It is known as pectineal line. Okay, this is known as pectineal line. And the surface just below the pectineal line, this one, it is known as the pecten pubis. Pecten pubis. Yeah, here also you can see the pecten pubis. And this is the pelvic side of the pelvic surface of the pubis bone. See, I told you this one is the symphyseal surface. What's this? This is a symphyseal surface. Now, this one is the superior ramus of the pubis bone, and this is the inferior ramus of the pubis bone. Superior ramus and inferior ramus of which bone? Of pubis. Now another demarcation between the ilium and the pubis bone. See this one, but it is in the form of an eminence. So this eminence is known as the iliopubic eminence. Now let's talk about this cavity. What is this cavity? This cavity is known as acetabular cavity. What is it known as? This is known as acetabular cavity. Okay, and then you can see a moon shaped surface, isn't it? Moon shaped surface. This moon shaped surface is known as the lunate surface of the acetabulum. What is it known as? It is known as the lunate surface of the acetabulum. Lunate surface of the acetabulum. Then this margin around the lunate surface is known as the acetabular margin. This margin is known as acetabular margin. Okay, now see, there is a fossa in here. This fossa is known as the acetabular fossa. Acetabular fossa. Okay, and in this part where the acetabular margin is discontinuous, this part is in the form of a notch, and it is termed as acetabular notch. Is it clear? I hope it's clear. It's easy. So you're done with the bony landmarks of this hip bone. I hope you understand. Now we'll deal with the muscle attachments. Oh, one more thing. This acetabulum, right? This acetabulum, it is formed. Two-fifths of its portion is formed by the ilium bone. Two-fifths of its portion is formed by the ischium bone, and the remaining 1/5 of this acetabulum is formed by the pubis. So let's check the muscle attachments of this hip bone. In this ilium part, the anterior superior iliac spine gives the attachment to sartorius muscle. The iliac crest gives the attachment to the tensor fascia lata muscle. This is the attachment of the gluteus maximus. You don't have to remember the attachments for a particular bone. I'm just doing it for a purpose. You'll remember it when we'll deal with the individual muscles. Okay. This is the attachment of gluteus medius, and this is the attachment of gluteus minimus. The superior inferior iliac spine, the posterior inferior iliac spine gives attachment to the piriformis muscle. Don't take stress, okay? Rectus femoris. This ischial spine gives attachment for the superior gemelli, and here for the inferior gemelli. See, this is the obturator foramen. Just below the obturator foramen you get the attachment for the obturator externus muscle. In the pecten pubis you get the attachment of the pectineus muscle. Simple. Here for the gracilis, adductor brevis, adductor magnus, and here you get the attachments for the quadratus femoris. Now let's check the inner aspect. Inner aspect, we term this fossa as the iliac fossa, so it gives the attachment to the iliacus muscle. This was what? Tensor fasciae lata. Sartorius, anterior superior iliac spine, anterior inferior iliac spine, rectus femoris. Here we get attachment for the erector spinae muscle. This muscle helps you give a straight posture. Okay. In the ischial spine and the inner aspect we can find two another muscles, coccygeus and levator ani. This help in forming the pelvic diaphragm. Okay. And just as we saw that the outer aspect, the obturator foramen is has the attachment of the obturator externus muscle, and so in the inner aspect we have the attachment of the obturator internus muscle. So now we are going to discuss the inferior view of the hip bone. This is the ischial tuberosity. The superomedial part of the ischial tuberosity has attachments of biceps femoris muscle. Superolateral has the insertion of biceps femoris. The inferomedial has the insertion of semitendinosus and semimembranosus. And this part has the insertion of the ischial hamstring part of the adductor magnus muscle. We are basically done with the hip bone. Just we need to look into the anatomical position of the hip bone. If the invigilator asks you to hold the hip bone in an anatomical position, then you should keep in mind that the anterior superior iliac spine and the pubic tubercle both should lie in the same plane. And how will you find whether they are in the same plane or not? So you can just put the bone in the wall so that both the pubic tubercle and the anterior superior iliac spine, both of them touches the wall. Okay, both should touch the wall. So we are all done and dusted with the osteology of hip bone. I hope you understand, and thank you for being with me. Bye bye.